Hey Sarah, how are you doing today?
Hey, I'm doing so good.
Good. Thanks so much for meeting with me today. I really look forward to these times that we get to sit and just reflect on your time here. There's going to be a lot we're going to cover in just a short amount of time today, but before we really get started, just wanted to give you an opportunity to kind of reflect on your clinical experience here at the Acute Rehab. So you've been here for a couple weeks, you've kind of gotten in a groove in terms of understanding what it is that we do, but at this specific clinical placement, what do you feel are the areas that you've grown in the most?
Oh yeah. So I feel like I've just had to work with a totally different population. I've never worked with adults before. So some of them are like kind of difficult. So I think probably like my bedside manner would have to be one of the biggest things. And I've also seen like a lot of dysphagia, and then cognition and memory stuff, which I've never really had to do before. So I mean, it's been interesting. I've liked it.
So this is the first time you've been with an older population or people with those sort of issues?
Yeah.
Okay, interesting. That's good to know. And what are the areas that you feel like you've struggled in the most? What has challenged you the most and you've walked away kind of going, I don't know if I did that as well as I should have?
Yeah. Well, like I said, I mean, this is my first time with adults, and so I think I'm just really kind of struggling with, I don't know, like I've just had a lot of exposure with kids, so like assessing them, and just knowing, you know, what's typical, what's not typical.
Yeah.
And then also like giving them the tests, like, oh, I can't even tell you how many times I've done the Con Lewis, you know. But like all of the adult tests, I think this is like either my first time or my second time.
Okay.
That I've attempted
So they're
to
very
do them.
new.
Yeah, so they're very new. So I will admit that's like a little more difficult. But yeah, I mean, like overall, I think I'm doing okay.
So assessments have been the main area that you feel like you
I
struggled
feel like I have struggled.
Okay, and what have you done since your time here to kind of pursue growth in those areas? So I guess with assessments, what have you kind of done on your own time or just to pursue growth on your own to get better at that?
Ooh, well, I mean, like all of my classes right now are geared towards adults.
Okay.
That's why, like, we're all in the adult settings right now. So, I mean, like, I feel like I've gotten some experience with the assessments, you know, in school. But I don't know, to be honest, that I've done a ton outside that just because I'm so exhausted after I've been at clinical day and then I have to do school at night, you know.
Well, I appreciate your honesty, and maybe that's something we can talk about towards the end, or ways to pursue growth in that area, because we really would love to see you continuing to grow. I know we talked about this at some earlier meetings we've had, but I just wanted to lay out our expectations of you, and these are also expectations that your university has in clinical experiences, but also specifically what we have laid out as expectations for students. So we're just going to kind of go through these and talk about them. So one of our expectations is to have above average interpersonal skills. So this is just an ability to talk and communicate with the people, your patients, your other faculty, any sort of interprofessional communication that's happening. How do you feel like you have been at interpersonal skills kind of in this setting?
I mean, like, I have to get used to new people every time I go somewhere, so I feel like I know my coworkers, like, pretty well.
Yeah.
I'm pretty good at, you know, just, like, making connections or whatever, and figuring out who, you know, we really need to be friends with in, like, these type of settings. But, yeah, I mean, I think this is a totally different dynamic than kids, and so I think it has been an adjustment, you know, going from adults to, or I mean, from children to adults, and so, I think these type of family members are way different than like the typical moms and dads that I've been working with. So I mean, like, it's definitely been different, but I feel like I'm doing okay.
Okay, I think it's really good to recognize that shift, that your interpersonal skills with family members of your clients are going to look totally different from maybe a younger mom to this may be the patient's daughter or son, or it could be their spouse who's also aging. So I think that's really good to recognize that there's a difference in that.
Yeah.
So kind of with interpersonal skills, so we expect you to engage with professionals around you, which you seem to have been able to do, to be on time and manage time effectively. How do you feel like you have done in this area?
you know, it's a little more tricky, I think, because when I was in the school system, like, all the kids came to me, so I never really had to leave and, like, go find them, and so this is a lot bigger facility than I'm used to as well, so, like, definitely it's taken me longer to figure out where everything is and figure out where the clients are, so, I mean, I would say I'm mostly on time, but there are definitely clients who I have been late to before, but only by, like, you know, a minute or two, so I don't really think it's been that big of a deal, and I feel like I've been able to, you know, make up the time in other places, so.
Okay, and I appreciate your honesty with that. I will say this has probably been one of those areas that we're gonna need to work on for the next couple of weeks. It's one of those things that really isn't acceptable at this stage, just and where you are in your graduate career, you're about to graduate, and this is kind of a basic skill that I would love to see some improvement in. And so kind of at the end, we're going to talk just about what we can do together and what you can do on your own to improve that. But yeah, we definitely I would love for us to be working on that one because that is something that it will just maximize your time with clients. It will, you will be presenting yourself in a much more professional way, even though it may just be a minute or two. What that says to the client and what that communicates to them is what I'm ultimately concerned about, communicating to them that they're not worth being on time or not worth our time. That to me is a really big deal, so I would love for us to talk more about that. So another expectation is properly documenting and recording information. I've noticed that you've been taking paperwork home or not being able to finish it at work. Why do you think that has been something that you've struggled with?
I mean, I feel like the time that I do have in between clients, like I'm going to another client or I'm going to pick up information, so I just don't, I'm kind of overwhelmed. I don't feel like I have enough time during the day to get everything that I need to get done.
This is another thing that it is just a standard expectation to get this done at work, and so I would love to talk about creating pockets of time in your schedule that you know are for documentation and for making sure paperwork is done before you leave. Because that's not something I want you to have to take home. Like you said, you do have school and you have a lot going on, and so let's find pockets of time in your day to be doing that. So this is something we talked about in our last meeting. We set some goals for administering assessment tools, doing that independently and doing that confidently. Do you feel like you've made some progress in that area since we last talked about that?
Yeah, I feel pretty good about that.
Okay, good. I've definitely seen growth in just your confidence. There's definitely still room to grow, and I think that that's just going to take doing them over and over. So I will probably pull you in anytime I can to get you to use those assessment tools just so that you're more comfortable, more confident in them. This was another thing we talked about in our last meeting, but writing those attainable and measurable daily goals for your clients. So how do you feel like this has been since we last met?
I feel like I have a better understanding of, like, what individual, I guess, like, diagnoses need and, like, what are the most functional things for them to improve on. So I feel like it has actually gotten better.
Good. Yeah, I've seen that. How are you doing your daily goals? Are you writing them down? Do you have a folder for them? Where are you keeping those for each of your clients?
I kind of just have this notepad.
Okay.
And I kind of keep them all there.
Okay.
So I don't know if that's, like, the best way to do that, but...
Do you feel like if I gave you a client's name and I said, can you show me the goals that you've had for John Smith over the past couple weeks, you could find those, or would that be something that would be hard for you to do?
I think for the most part, I could find them.
I would definitely encourage you to make sure that is very organized. That is something that we're going to want to look back on. We're going to want to build new goals off of old goals that have either been met or not met, and so that is really important just to have those in a way that you can find them. So kind of those last expectations, making clinical decisions. We talked about that as well as another thing we set some goals for. How do you feel like that has been going?
I mean, I definitely think it's better. I'm just getting more and more comfortable with, like, the populations.
Yeah.
So, yeah.
Okay.
I feel okay about it.
Okay. It's another area I have seen growth in, which is awesome, seeing you go in and selecting therapy materials that you think are going to be appropriate for that client. I've definitely seen you doing that more and would love for you to be doing that completely independently by the time that you're finishing. And the last one is to be practicing self-reflection. I don't know if you've noticed, but I've kind of asked you how you feel like you're doing with these things because I really want to encourage you to know your strengths and weaknesses, to know when you need to ask for help, to know when it's an area you're growing in and you kind of just need to push through and figure some things out. So something I really want to be focusing on for the rest of your time here is just that self-reflection. I'm going to give you a sheet at the end of this that you're going to be able to fill out at the end of every day with just some self-reflective thoughts of how you think the day went, so that next time we meet, you can bring those in and we can look at the things that you think you did well and you think you need help with and kind of compare them to what I was seeing. But overall, I've definitely seen growth since we met last time, which I think is great. But specifically with time and managing your time and that documentation that we talked about, I would say that those are the two biggest things that we really need to see growth in. Those are very basic level things. And just with where you are in the process, I don't know if you've heard of Anderson's Continuum. Have you heard of that? And it
sounds familiar.
Okay, so it has to do with supervision. And so when you came to us and you started, I was kind of taking the bulk of the weight of my clients, and then you were up here kind of learning. And throughout the time that you've been here, our hope is to switch those roles, and that by the end you are able to carry that weight of treating those clients, and I'm able to just kind of support you and encourage you when needed. And just with where we are in your education, I think it's really important to make sure we are shifting down that continuum and you're continuing to carry the weight. So I would love to talk about those two main things: time management and documentation. So what do you think are some good ways we can work on time management?
Sometimes I don't realize that I've either like run over and now I'm late to another session. So I guess maybe I could set an alarm on my phone.
Yeah,
like
that'd be a great idea.
Every session, so I would know when it was like supposed to end.
Yes, I think that's great, just to keep you aware, and I think the client will appreciate that too. They have things to do and places to be.
Yeah.
And then the other big thing we talked about was that documentation. So let's think about your day. Let's think about the moments maybe when you are going to talk to someone just to kill some time, or you're walking around, or just moments like that you could be doing documentation and paperwork. Can you think of any pockets in your day that we can set aside specifically for paperwork, or maybe things we can take time out of? Like if you're eating lunch for an hour and a half that day, maybe we can move lunch to 45 minutes and then do 45 minutes of paperwork.
Yeah. I think like, I don't know, it's so hard because I feel like our days just move so quickly. I have, pockets of time here and there in between clients, and sometimes I'll come and a client, will be getting a bed bath, or someone else will have them, or, like they won't be available for therapy right then, so maybe I could take that time instead.
I think that's a great idea, and even thinking about that notebook, if we could get that really organized, I think what would be awesome is something that you could just carry around with you. And since you're going to be on time to these clients, maybe even early, if you get there and they're not back from PT or something, you could just be waiting for them, kind of filling out some paperwork if you need to, that you could just close the moment they walked in. I think that would be a good way to, because I agree, it's a busy day, but finding time in the margins. I would love for you to be documenting the time that you find the paperwork, to do paperwork. So let's work on finding time in the margins, since there may not be a huge pocket of time. Let's find those times that we can be working on paperwork, just to make sure we're getting that done before we leave. This has been great. I hope you feel like you know a little bit more of kind of the things you've been doing well, the things that you can work on, and I really would love to see improvement specifically with time management and that documentation stuff. So that's what we'll be following up on next week.
Okay.
Thank you, Sarah.
Thank you.